Hi there, and welcome to Vitalize Health Partners website, where we are arming you with information so you can be fully informed on medical conditions or you just had a question about something. So, I'm Dr. Andrea O'Connor, and feel free to schedule a one on one consult. You can visit our website, vitalizehealthpartners.com. And for one price, you get two consults. You get one with our health coach, Aaron, and then me, Dr. Andrea, where you can ask any question on your medication, your treatment, your diagnoses, or you just have questions in general about what's going on with your health. Even though I can't act as your doctor, I am a doctor. And so I would be happy to educate and inform. So, one thing that I did say I was going to talk about was, are you aware that there is a lot of integrative natural treatment for common viruses that we are now all experiencing, like COVID, coronavirus, right? And, maybe your doctor has talked to you about remdesivir, or you've been on remdesivir, or you were on monoclonal antibody therapy, or maybe you did have the original virus and you were hospitalized and now you're here to tell about it. So if you've been through that, you're probably like, I don't want to get COVID again. But I tell you what, I think I've had COVID 4 or 5 times now. I'm so over it. I know plenty of people that have gotten it a few times. I know people that have never had it. It's just bizarre. But I have patients that will tell me, I don't want to take remdesivir. I don't want to take azithromycin. I don't want to be on hydroxychloroquine. I don't want to be on ivermectin. I don't want to be on, they just want to go all natural, where there's a lot of things in the natural world that are antiviral. And I thought I would inform you of, did you know, right? Did you know? Well, did you know vitamin D3, of course, is so immune supportive and antiviral, and that's why it's so good to sit in sunshine, right? Yeah. Some patients have to take a vitamin D3 supplement to get as much as they need. So you might want to make sure you talk with your doctor. Is that right for you? Are you on the right dose, etc.? The other big one, and this is really for preventing viruses, is of course vitamin C. You know this. Most over-the-counter vitamin C comes in 500 milligrams at the minimum, up to 1,000. The RDA is much lower than that, but for prevention, a lot of people need to take at least 500 milligrams. But again, not everyone can take vitamin C, and some people it causes gas and diarrhea, so they've got to talk with their doctor to make sure it's okay with them. Zinc, you guys have heard of that. It's the next big one, right? Melatonin. Believe it or not, melatonin acts as a powerful antioxidant, works at the level of the brain, and is really great for prevention and treatment. Elderberry syrup. It really tastes quite good. I take a teaspoon of elderberry syrup whenever I'm exposed to someone that's been sick with a coronavirus or something similar. It's really wonderful. And then bromelain, quercetin, curcumin, and resveratrol. So it's a combination of those that's really great for prevention. However, for treatment, I kind of like curcumin alone. And then coffee, which I am so glad to know about because I love coffee. I mean, I am not going to be a hypocrite and say don't drink coffee. I do love coffee. And apparently, through research, regular coffee drinkers have a little bit more going for them as far as preventing COVID. Well, that's good news for me because I love COVID. So now when we switch over, like someone actually has COVID now and we want to treat them, but they are refusing all known standard treatments. Well, when that happens, like they don't want the ivermectin and hydroxychloroquine, that's fine. They don't want remdesivir, that's fine. So a lot of doctors agree. And you can see the website too. It used to be called FLCCC. Agree on starting an antiseptic mouthwash. This is good for prevention too, by the way. I don't like doing an antiseptic like Listerine and stuff like that daily forever. It's really not good for the microbiome of your mouth. But if you're actively trying, like say you have a family member with an illness, you're actively trying to prevent it. A lot of my patients, I tell them antiseptic mouthwash. And then the natural stuff that has really some great antiviral properties, Nigella sativa, curcumin, I mentioned that, zinc, melatonin, mentioned that, probiotics, particularly with Bifidobacterium. We talked about vitamin C, we talked about D, of course. And then I'll add on a lot of research has shown that the virus cannot replicate as well if the patient has a little nighttime dose of Benadryl, a little lactoferrin, and some lung protection with NAC, or known as N-acetylcysteine. And then in even some cases, metformin. And I'm not going to go over dosages here because I'm not your doctor, but these are some tried and true safe remedies that you could talk to your doctor about and make sure it doesn't interact with any of your medications. And is this safe for you to take? Because I'm not telling you to do this. I'm just saying I have found these things are researched, studied, and they really work well. So comment below if you already knew that, or if any of these things were new to you, and kind of what your doctor has kind of recommended, or are they recommending things like that? And again, if you want more of a deep dive in what's going on with you, and you want to hear more about what you can talk to your doctor about, like specific medications you're on, can you take these things, because again, we're here to give information and education. Again, I'm a doctor, but I'm not your doctor, right? But yeah, to schedule a one-on-one consult, you can just go to our website, vitalizehealthpartners.com. I hope this was valuable information for you, and something you did not already realize. Okay, thanks for being here.